our good friend Dr. Todd Battaglia, our weekly SOS house call. Dr. Todd, how are things today?
I'm doing well. How are you guys?
We're great. Baseball's back in our lives. Opening day tomorrow. Are you a Yankee fan by chance?
As far as I follow baseball, I'd say, unfortunately, I like the Pirates a little bit, too. I got a buddy who works for them. So
Nice. Paul Skeens, he's the man.
O'Neill Cruz, I like
right.
him.
Yeah. All right, well, we're going to start with the Yankees, and their pitching staff right now has got a lot of injuries, and Clark Schmidt, the latest to go down with an injury. He's dealing with shoulder fatigue, shoulder soreness. Is it surprising to you the season hasn't even started yet, and he's dealing with this injury? Can you explain kind of what that is, and is that a concern, for the rest of the season, or is that something he could bounce back from rather quickly?
Yes, it is a little weird to be dealing with that, as the season's just getting started. I would take that to mean he's probably got some rotator cuff tendonitis or bursitis, some of those overuse things. And, maybe he came into preseason not fully in shape or shoulder not quite in throwing condition, but hopefully they can get him through that, because if not, it's going to linger and bug him all season.
A report released by MLB, staying with pitchers, shows that Tommy John surgeries essentially tripled between 2010 to 2020. And the study went as far as suggesting that some sort of rule change should be implemented to prioritize health of the pitchers. That same study revealed that 35 players taken in the first 10 rounds of last year's amateur draft have undergone that procedure. So can you, explain why we're seeing triple the amount over the course of that 10-year span? And, do you think that some rule changes should take place to protect guys?
Yeah, so there's a lot that plays into it. I mean, we don't have any major league teams we're taking care of around here, but even at the high school and college level, the rate of Tommy John surgery or ulnar collateral ligament reconstruction has gone through the roof. And some of it is simply the fact that human elbows really weren't designed for the kind of stresses that high-level pitching puts on it. But a lot of it, too, is that kids and these players, particularly in high school and college and whatnot, they pitch year-round now. Between travel teams and clubs and the school team, there's almost no downtime, and this cumulative damage is just wearing out their elbows. So, we're seeing it more, we're doing it more, and as common as it is now, it's not a guarantee you get back to playing the full way. In fact, the most recent statistics say that maybe 2/3 of guys ever get back to pitching at the level they were exactly at before. So if pitch counts or, restrictions on throwing somehow can lessen that a little bit, it certainly is going to be good for the longevity of these elbows.
You talk about the longevity there. That's where I was going next. I mean, does the procedure have any negative long-term effects, anything that can hold these guys back, or is it just a case of sometimes they just don't get back to where they were prior to the surgery?
Yeah, so, I mean, if it's fixed and turns out rehab successfully, you certainly can get back to throwing at a high level the way you were, but sometimes you just don't get your normal mechanics, you don't get your speed, you don't get your control back exactly, and especially if you ever re-injure it again, if you have to go through it a second time, you might as well, throw in the towel almost. It's very rare to come back at a high level from a second reconstruction.
Now, we've seen over the course of the last decade or so that some MLB players and other athletes have used what's called a SAM device. Can you explain what this is and how it helps in an athlete's recovery?
Yeah, so it's pretty straightforward. They're advertised, I think, as like an acoustical healing machine. Basically, they're an ultrasound machine. They're a machine that delivers localized ultrasonic signals or waves into the area of injury and essentially trying to stimulate blood flow, sort of stimulate the body's ability to heal itself. We use ultrasound for all kinds of injuries, tendon, and even to help stimulate bone injuries sometimes. It's not, an end-all, be-all, cure-all kind of thing, but it does add one extra level of stimulating tissue recovery and healing and those kind of things.
All right, let's move on to the NBA. And news came out yesterday about Damian Lillard that he's been diagnosed with a blood clotting issue in his right calf, and he's the third guy this year in the NBA to be sidelined with a blood clotting issue. Why is that? Is it a coincidence? Are they doing better testing for this kind of thing? How do you explain three guys in a short period of time being diagnosed with this?
Yeah, I don't know if I have a good explanation. So, there are certainly risk factors that that make your risk of blood clots higher, some genetic things, an injury if you get, kicked in the calf or something and have extra swelling or something there. But beyond that, there seems to be a little bit higher rate in taller individuals. These guys do a lot of sitting around, a lot of time on plane rides and stuff, which is a risk factor. But why it would be more now than it was 10 years ago or 20 years ago, I'm not sure I really have a good explanation for that.
Going to the college game, unfortunately, we saw maybe the best player in the country in the women's game, Juju Watkins, go down with an ACL tear, ending her season. There's a 2011 study out that found that female athletes are anywhere from 2 to 10 times more likely to suffer an ACL tear than their male counterparts. Why is that?
Yeah, so that study's not alone. There have been numerous studies that have proven that pretty conclusively. And if you really settled on a number, females are probably at least 6 to 7 times more common to tear their ACLs than men. There's lots of different factors that come into it. Some is anatomy and sort of how the inside of the knee is built and the room for the ACL. That tends to be a little smaller in women, so the theory is that maybe the ACL gets kinked or caught a little bit more easily. Females also tend to have slightly different mechanics. They tend to jump and land with a bit more knock-kneed sort of stance, where guys tend to be a bit more bow-legged, and unfortunately that knock-knee puts a little more stress on the ACL. And then there's some controversy about hormonal stuff. So women in general tend to be a little bit more loose-jointed, particularly if you think about what happens in childbirth and how much the pelvis has to stretch. Their estrogen and some of the female hormones make your ligaments a little bit looser, a little bit stretchier as well. That may play a role.
We've seen, we talk about how they're more likely to tear their ACLs, but we've seen players come back and be just as good, if not better, than prior to the injury. Sue Bird, Paige Beckers, Candace Parker, all players who tore their ACL and they came back and they were fantastic afterwards. Is there a difference in the recovery process, male to female, when it comes to, coming back from ACL tears?
No, I can't really say that I've seen much in that regard. I mean, a lot of people who go through ACL surgery certainly come back to the same level. I mean, it's an incredibly common surgery these days. There's, intense rehab afterwards, so it's probably a function of even further maximizing your strength and all that kind of stuff than it even was prior to surgery. But even with ACL surgery, people think get it done and a year later you're automatically back. The studies that really dig into it, somewhere around 10 to 20% never make it back to their previous level of performance. So it's not always a home run after ACL surgery either.
All right, let's finish up with the men's tournament. And Arkansas's leading scorer, Adu Thero, expected to return from a hyperextended knee in the Sweet 16. He's been out for about a month with that injury, did practice last week, and seems to be trending toward playing. Does that seem like a normal time frame for you in terms of returning from a hyperextended knee? And is there a great risk of re-injury with that?
So I do think that's a pretty accurate, pretty standard timeline. It ultimately depends on how bad the hyperextension was, but in general, hyperextension injury causes some ligament strain. It usually get a little bit of bone bruising, a little bit of swelling on the knee, and that can take a few weeks to calm down. Assuming he's rehabbed correctly and his strength is back to pre-injury levels, his risk of re-injury should be relatively low.
All right, Dr. Todd, as always, appreciate the time. Very insightful. Enjoy the rest of your week, and we'll talk again soon.
Thank you, guys. Have a good afternoon.
All right, you as well. Dr. Todd Battaglia joining us here. Weekly SOS House Call. We'll take a time out. We will wrap up hour number 1 next. Etan Thomas coming up at the top of hour number 2. We're back after this on ESPN Radio.